Hi everybody, we are the audiologists from Associated Hearing Professionals. I'm Tina, this is Margaret, this is Lauren. October is Audiology Awareness Month, so every week we're sending out a little short video to tell you a little bit about what it is that we do. Today we wanted to talk about what causes hearing loss and what causes tinnitus, or tinnitus some people say, which is a ringing or buzzy sound in your ear. So who wants to talk about that first?
Well, one of the causes can be hereditary. There are several genes that have been identified, and so there are familial hearing loss. So a lot of families know that it runs in the family and they may be aware.
And we have several families that we take care of who have many family members
Yes.
with that familial hearing loss.
And then noise-induced hearing loss is very common from recreational noise exposure and occupational noise exposure and service-related. So a lot of people aren't aware of what damage they do when they're using real loud equipment and they don't use any ear protection. Even lawn equipment can cause irreparable, irreversible hearing loss. That it causes a sensory neural loss, and no medicine or surgery will help that. Patients, their only option is to get amplification for help.
If I could just, I'm sorry.
Oh no.
If I could just say one thing regarding like the lawn equipment and like leaf blowers, snow blowers. Some people will say, well, I don't need to wear hearing protection because I'm listening to my music while I do it.
My
And
husband.
then and then they turn up the music so loudly to hear it over that equipment they're
noise.
using, that then their music is causing noise-induced hearing loss. So that is a big one. I'm sorry, what were you going to say?
Well, I was going to say that I think too what people don't know is that even though, they don't listen to really loud music anymore, or they don't play in a band anymore, or they don't shoot guns without hearing protection anymore, they think that because they're not doing it right then and there that their hearing isn't going to be damaged. But things that you've done in your past can have an effect on your hearing a long time, in the future too. So it's important to be aware of how detrimental noise can be.
Some other causes of hearing loss, for example, certain medications can cause hearing loss, certain chemo drugs, certain strong antibiotics, and even if they don't cause a hearing loss, other medications might cause the tinnitus or ringing in their ears.
Yes, good segue.
There you go, thank you.
Another cause is ear infections, which are very common in young children, and they often can be treated medically by an ear, nose, throat doctor, and don't have to become a permanent hearing loss, but you do need to seek help for an ear infection because it can become a very serious problem.
And so, we mentioned also that we were going to discuss tinnitus, and so hearing loss can cause tinnitus, right? So we know that from hearing loss, the brain knows that there's an absence of sound, and in place of that, we hear the sound or a swishing noise, or it might sound different for every single person. Only you know what your tinnitus sounds like, right? And so I think it's really important for people to know that when you treat the hearing loss with a hearing aid, often the majority of the time we're also addressing the tinnitus that you're having. And so when we program a hearing aid, we can address tinnitus. We can try to make it not so noticeable, not so bothersome. One time somebody told me an analogy. If you go into a dark room and the only thing on is a candle, what's the one thing that you're going to focus on? It's the candle. But then if somebody takes that dimmer switch and slowly turns on the light and gives you more surroundings to look at, you're distracted. You don't look directly at the candle. You're able to pick out the things in the room that you didn't see before. And that's kind of the same thing with tinnitus. When we program a hearing aid appropriately for that hearing loss, in doing so, we're distracting the brain from focusing on that ringing or buzzing or swishing and focus on other things.
So I think we've just hit on a few of the causes of hearing loss and a little bit about tinnitus. In the past, people were often told nothing can be done about tinnitus, but that's no longer the case. If you have more questions about hearing loss or tinnitus, we'd be happy to address them for you. So please give us a call, 636-778-9232, or our website, www.hearstl.com.